So good day. We are going to start this video from where we had left in the previous one. We were discussing about the iliac crest, which extends from the anterior superior iliac spine to the posterior superior iliac spine. And the summit of the iliac crest, it is slightly behind the midpoint of the anterior and the posterior ends. Okay. Now, when the two summits of the two iliac crests are joined, then the transverse plane passes through the lower border of the spine of the fourth lumbar vertebra. Okay, and this is known as the supracrestal plane. The posterior superior iliac spine, it corresponds to a skin dimple at the back, and it passes through the spine of the second sacral vertebra, and it is here where the subarachnoid space of the spinal cord ends. And this is the anterior border beginning from the anterior superior iliac spine, and then there is a notch below the spine. This is then a bony projection, which is the anterior inferior iliac spine, and the anterior border ends at the upper margin of the acetabular cavity. To the anterior superior iliac spine, we have the lateral end of the inguinal ligament attached, and below it is the origin of the sartorius. The lateral femoral cutaneous nerve, it passes along the notch between the two anterior iliac spines. So, the lateral femoral cutaneous nerve, it passes below the inguinal ligament, curving around this notch between the anterior superior iliac spine and the posterior and the anterior inferior iliac spine. The upper part of the anterior inferior iliac spine gives attachment to the straight head of the rectus femoris, and the lower part to the stem of the iliofemoral ligament, which is a very strong ligament that prevents the backward tilting of the pelvis on the femur. Okay. Now, this is the posterior border. The posterior border begins from the posterior superior iliac spine, and the upper part is rough, extending up to the posterior inferior iliac spine. Okay. It is rough because of the attachment of the sacrotuberous ligament like this. The sacrotuberous ligament is attached to the upper part of the posterior border and then to the medial aspect of the ischial tuberosity. Okay, this is the orientation of the sacrotuberous ligament, and here you can see this is the ischial spine. From the ischial spine extends the sacrospinous ligament, and these two ligaments are oriented like this, the sacrotuberous and the sacrospinous ligament, and they convert the greater sciatic notch, this notch, and the lesser sciatic notch into greater sciatic foramen, and this is the greater sciatic foramen and this is the lesser sciatic foramen. Okay, they convert the notches into foramina. Then the posterior border forms the superior and the anterior border of the greater sciatic notch, and then it continues with the dorsal border of the body of the ischium at this level. Okay, this level corresponds with the stem of the triradiate cartilage, Y-shaped triradiate cartilage in the floor of the acetabular cavity, and it is the junction between the ilium and the ischium. Okay. So the posterior border continues with the posterior border of the body of the ischium. Now this is the medial border. The medial border, it has three parts. The upper 1/3 is rough because of the attachment of ligaments. The lower border is sharp, forming part of the auricular articular area, and the upper part is rough and the middle part is sharp. The lower part, this part is rounded, forming the arcuate line, and it extends up to the iliopubic eminence. This bony thickening is the iliopubic eminence. So the medial border, as you can see, it has three parts: posterior 1/3, a middle 1/3, and an anterior 1/3. Okay. So the lower or the anterior part is the arcuate line. The medial border, it separates the iliac fossa from the sacropelvic surface. This is the sacropelvic surface and this is the iliac fossa. The iliac fossa is bounded above by the inner lip of the ventral segment of the iliac crest. Anteriorly it is bounded by the anterior border and posteriorly it is bounded by the medial border. And the upper 2/3 gives attachment to the iliacus muscle, and the lower 1/3 is the bone is separated from the muscle by the passage of the iliac branches of the iliolumbar vessels. And the medial part of the iliac fossa is traversed by the psoas major muscle, and the iliacus and the psoas major muscle passes in the gap between the anterior inferior iliac spine and the iliopubic eminence to the front of the thigh. Okay, this is the iliopubic eminence. The iliopubic eminence is the junction between the ilium and the pubis, between the ilium and the superior ramus of the pubis. This is the superior ramus of the pubis. This junction is known as the iliopubic eminence. The arcuate line continues with the pectinate line and then with the pubic crest and the upper margin of the symphysis pubis, and it forms part of the pelvic brim. The pelvic brim separates the false pelvis from the true pelvis, and it forms the plane of pelvic inlet. Okay. The sacropelvic surface is so called because it has two components. This is the sacral part and this is the pelvic part. The sacral part presents a very prominent ear-shaped or auricular-shaped articular area. It is known as the auricular articular area, which articulates with the similar area of the sacrum. And it is covered with hyaline cartilage, forming a plain synovial type of joint. Above and behind this articular auricular area, there is a large bony thickening which is known as the iliac tuberosity. So this rough large area is known as iliac tuberosity. Please differentiate it from the tubercle of the iliac crest. This iliac tuberosity, it gives attachment to the iliolumbar ligament, in this part to the dorsal sacroiliac ligament, and here you have the attachment of the interosseous sacroiliac ligament. Okay. It is one of the strongest ligaments of the body. Just below and in front of the auricular area, there is a groove which is known as the preauricular sulcus. The preauricular sulcus gives attachment to the ventral sacroiliac ligament, and this sulcus is deep in case of females because of the stretching of the ventral sacroiliac ligament in pregnancy. Below and in front of the preauricular sulcus, there is attachment of the piriformis muscle, few fibers of piriformis along the inner aspect of the upper border of the greater sciatic notch. The piriformis, it passes like this, and it passes through this greater sciatic notch, as you can understand, and this muscle is the key muscle of the gluteal region because there are several structures passing through the greater sciatic foramen or greater sciatic notch into the gluteal region above and below the piriformis. The structures above the piriformis are the superior gluteal vessels and nerve, and there are 8 structures passing below the piriformis. Okay, 8 structures passing below the piriformis. They are named from lateral to medial in this sequence. First, the lateralmost structure is the sciatic nerve. Then there is the nerve to quadratus femoris under the cover of the sciatic nerve. Then medial to it is the posterior femoral cutaneous nerve, and further medial to it is the inferior gluteal nerve, then inferior gluteal vessels. Then you have the nerve to obturator internus, internal pudendal vessels, and the pudendal nerve. So the medial 3 structures, the medialmost 3 structures are the nerve to obturator internus, internal pudendal vessels, and pudendal nerve. And the way I have named it is from lateral to medial. Okay. Now these medialmost 3 structures, they are important because they only undergo a very short course in the gluteal region over the dorsal aspect of the ischial spine. They emerge into the gluteal region through the greater sciatic notch below the piriformis, and then re-enters into the pelvic aspect through the lesser sciatic notch. Okay, so they undergo a very short course in the gluteal region along the dorsal aspect of the ischial spine. These structures are also called the pin structures. Pin means pudendal nerve, internal pudendal vessels, and nerve to obturator internus. And this sequence is from medial to lateral and not from lateral to medial. So once again, the structures that are emerging below the piriformis through the greater sciatic notch from lateral to medial are the sciatic nerve. Under the cover of the sciatic nerve is the nerve to quadratus femoris, then the posterior femoral cutaneous nerve, then the inferior gluteal vessels, inferior gluteal nerve, then the inferior gluteal vessels, then the nerve to obturator internus, internal pudendal vessels, and pudendal nerve. Okay. Now, here in the sacropelvic surface, the pelvic part, it is continuous with the pelvic surface of the ischium. Okay, and the major portion gives attachment to the obturator internus. So, the sacropelvic surface, we have we are having the ischial tuberosity, then the auricular articular area, the preauricular sulcus, attachment of piriformis, and then here is the attachment of the obturator internus. Okay, this entire area. Now let's come to the gluteal region, the gluteal surface. The gluteal surface of the ilium, it is divided into 4 areas by 3 lines. These lines are the posterior gluteal line, the anterior gluteal line, and the inferior gluteal line. All these gluteal lines, they emerge from the upper margin of the greater sciatic notch, and the posterior gluteal line goes to the iliac crest at the junction of the dorsal 1/3 and the ventral 2/3. Okay, and this is the anterior gluteal line which goes to the iliac crest at the tubercle of the iliac crest, and this is the inferior gluteal line which goes to the upper aspect of the anterior inferior iliac spine. So these 3 lines divide the gluteal surface of the ilium into 4 areas. The area behind the posterior gluteal line, it gives attachment to the gluteus maximus and the sacrotuberous ligament. The area between the anterior and the posterior gluteal line gives attachment to the gluteus medius. The area between the inferior gluteal line and the anterior gluteal line gives attachment to the gluteus minimus. This area below the inferior gluteal line, just above the margin of the acetabulum, here it gives origin to the reflected head of the rectus femoris. Remember that the straight head of the rectus femoris is attached to the upper part of the anterior inferior iliac spine, and the reflected head is attached to the gluteal surface of the ilium, just above the acetabular margin and below the inferior gluteal line. Okay, so in the next video we shall continue with the ischium and the pubis. Thank you for a patient hearing.